Ulcerative colitis is a common type of inflammatory bowel disease characterized by the appearance of inflammation and ulcers along the inner lining or membrane of the colon. These ulcers are spots on the mucosal membrane where the tissue has eroded away, leaving behind open sores or breaks. The pattern for ulceration is continuous and circular, starting from the rectum then up along the colon. Colitis is a chronic condition that has periods of remission and relapse. Remission is the complete resolution of symptoms and healing of the colon lining. Relapse is the flare of symptoms either after medical treatment or spontaneously. The exact pathogenesis of colitis is unknown. Environmental factors such as diet and stress were once suspected to be the cause. However, now these factors are thought to be more secondary. The condition is now thought to be autoimmune in origin, where the body's immune system mistakenly attacks its own healthy cells and creates gastrointestinal ulcers in the process. A type of white blood cell known as cytotoxic T cells are often found in the lining of the colon. These are immune cells that normally kills damaged cells. It is thought that inflammation and ulceration is caused by the T cells mistakenly destroying healthy cells that form the wall of the colon. However, what exactly the T cells are targeting is unclear. Some patients have a special kind of antibody called PANCAs that incorrectly target so-called foreign substances in the body's own immune cells. It is not completely understood why these antibodies appear in the blood, but it's suspected to occur due to an immune reaction to specific gut bacteria that are structurally similar to the body's own cells. Antibodies to those gut bacteria therefore cross-react with immune cells, destroying healthy cells in the process. Symptoms vary over time and from person to person depending on the extent and severity of the inflammation. The principal symptom is frequent diarrhea that is often bloody. Diarrhea occurs when the colon cannot perform its normal function in absorbing water due to the damage on its surface. Other symptoms include abdominal pain or discomfort, urgency of defecation, nocturnal bowel movements, and weight loss. Treatment depends on the severity of symptoms. Often anti-inflammatory drugs are the first step in treatment. This type of medication includes 5-aminosalicylates and sometimes corticosteroids for more severe colitis. If patients do not respond, they are prescribed immunosuppressants such as azathioprine and cyclosporin to suppress the immune system from starting inflammation. If those fail, biological treatments such as TNF inhibitor and infliximab can be trialed. Finally, if all drugs fail, patients will sometimes have a colectomy, which is the surgical removal of the colon to eliminate the diseased parts of the colon. Ulcerative colitis is a chronic condition that affects the quality of life and is a possible precursor of other critical conditions such as colon cancer. It is therefore important to be aware of the symptoms to undergo appropriate treatment accordingly and manage the condition effectively.